program is going to revolutionize your therapeutic approach. You're going to be seeing children in shorter, more frequent sessions. Your therapy program is going to consist of taking the children that need articulation therapy and grouping them into sessions where you see them for 5 to 10 minutes, 2, 3, 4, or 5 times weekly. Your Speedy Speech binder includes everything that you need for your therapy program. It includes the drills, the pictures, the words, the sentences. It even includes your therapy materials like the tooth bats, the tongue depressor, the mirror, your gloves, everything that you can think of and need for therapy. Okay? What I want to do is go through the components of the book, just to explain them and answer any questions about how to use the program. The binder includes a comprehensive guide that explains step by step how to implement this program into the school-based setting. So if you just take a few minutes to read it, I think most of your questions will be answered here. But of course, we're available, you know, with anything that comes up. The program takes the children through the different stages of remediation. It begins with auditory bombardment, and you have a list here of all of the words that are in the program so that you can bombard the student auditorially to get used to hearing the sound, and then eventually move on to auditory discrimination, which is the next section. You have some auditory discrimination pair sets here that you can integrate. We recommend that you integrate either auditory bombardment or discrimination just for about 1 minute for every therapeutic session, just to really get the sound ingrained with the child. Okay, you have a sound bridge, which helps you elicit the sound in isolation or consonant-vowel combinations. You then have your initial 1 syllable, and each drill set you'll see is grouped into sets of 3 words where they have the word, a phrase, and a sentence. And these are the stages that you would move through with therapy depending on what level the child is. You see at the single word level, see at the phrase level, or the sentence level. Everything is right here for you to use during therapy. Okay, and then after initial 1 syllable words, you have initial 2 syllable words followed by final 1 syllable, final 2 syllable, medial 1 syllable, and medial 2 syllables. So you have all of them here ready for use.
Very organized.
In your binder, yeah, definitely.
So complete.
So at the end, you have your conversational speech prompts. You know, I'm sure you have the ones that you use regularly, but sometimes we're sitting there in therapy and we can't think of something. So here they are, right for you, so that you can get these kids talking as they transition over into the conversational speech stage. Okay, with your sound. Now, the program also includes a big stack of handy reproducibles, which you can use throughout the course of the therapy process. You have your therapy log, which is designed for easy and quick data input. You have an area where you can jot down your production samples and get a quick percentage out of 10 for every session. We recommend that you do this regularly because this is what's going to tell you if a child is ready to move on. You have a caseload summary here to help you track the children who progress through the program. Throughout the year, you're going to have kids that cycle in and out. You'll see that the children will complete the program in 2 to 3 months in most cases.
That was my question to you.
So
around, usually, typically, like 2 to 3 months.
Right. I mean, some kids are sooner, and some kids take longer. I found over the years that I've been doing it at my school that seems to be the average. But every child is different, so it's really just about tailoring the program to meet their needs, but certainly making every effort to move them in and out of the program as soon as possible. This is really meant to help those children that end up spending years in therapy, and by using this methodology, we found that they're not in therapy for 2 to 3 years. They're just in and out, back in the classroom, and problems fixed. So, okay, for those kids that need the motivational piece implemented, we've included a speech star chart, a certificate, and another little star to decorate and hang somewhere. We mentioned in the book that most children are naturally motivated. The one-on-one interaction and having your undivided attention is enough to keep them motivated throughout the 5 or 10 minute session. So this is not necessary in most cases. This should only be implemented when you're having a child who's having difficulty completing the homework or who's just not motivated with the therapy session. And this is something that you can introduce, okay? We also have several school and home letters. The program really tries to solidify that home-school connection. We want to involve the parents, the teachers, in a collaborative effort to help this child improve their speech sound. So we have designed a series of letters to help you facilitate that process. For example, we have a program introduction for teachers. Most teachers aren't familiar with this methodology, so this is a way to introduce the program to them, explain its effectiveness, and hopefully help get them on board with the program. You also have teacher tips so that the teachers can...
Yeah, that's great.
Definitely, so that the teachers can apply some of these strategies to help the child within the classroom on a daily basis. You have your therapy schedule, just something that you can jot down, a quick schedule for the teachers so that they have an idea of when you're going to be popping into the classroom. For the home, we have, again, a program introduction for the parents explaining the methodology of service delivery. We have a homework calendar introduction. There's some homework calendars in the program, and this helps introduce that concept and the daily routine of practice at home. We have a target sound change letter, because sometimes you might be working with a child that has 2 different sounds or more sounds. So at first you might be doing an R or an S, and then you want to switch to a different sound. So this is just a letter telling the parent that now we're going to start working on this different sound so that the homework, the practice that they do at home reflects that change. Practice tips for parents. More specific homework calendar directions that explain how to do the homework on a daily basis with the child. We also have a student and homework helper rating scale, which I put in the homework notebooks every week, and then the parent or the homework helper helps the child rate his or her own progress throughout the week, and the homework helper also rates how the child did with the homework. So this is really great because it helps us keep track of what's going on at home, you know, and we just use it for communication back and forth with the parent or homework helper. Okay, we also have our homework calendars. Basically, these are generic homework calendars that can be applied to any sound, and they help the child elicit words that have their speech sound. So for example, it might say, describe some fun things to do with your speech sound. Okay, the child can think of a number of words that are fun, that have their speech sound, and they jot them down in their notebook. And then what starts to happen is over the course of the month, they start developing these lists that are meaningful to them because they're words that they've come up with and then have their speech sound. Sometimes I get asked, well, do we send this homework if the child doesn't have an intact sound yet? Or yes, because the parent can work on auditory bombardment with the child, so you have to just explain to the parent not to do negative practice with the child if this child still can't say the sound correctly, but to gather the words with the child and then just say the words aloud to their child so that they're getting that auditory input of the sound. When the child is ready to begin the verbal practice of the words and the sound, then they can start practicing themselves. But it just can shift easily from one level of practice to another. Okay, so that's really it as far as the forms and the makeup of the program.